in consonance with Republic Act 7722, otherwise as the Higher Education Act of 1994. And this is also in consonance with or advocated by CMO or CHED Memorandum Order number 46, series of 2012, which is policy standards to enhance quality assurance in Philippine higher education for outcomes-based and typology-based quality assurance. So there are several articles for the CMO, but I am just discussing articles 1 to 4 because these are the most important things that you need to know. The others are syllabi and the requirements for the administration, the College of Nursing, the resources, and the facilities. So Article 1 is the rationale, and Section 1 talks about the rationale for the BSN curriculum. So as I stressed again, there is a major shift from competency-based standards to outcomes-based education. So CMO number 46 series of 2012 was followed by all professions in the country except for the legal education. So it specifies the core competencies expected of BSN graduates, regardless of the type of higher education institution they graduate from. Okay, so this PSG also provides ample space for the BSN program on how to design and innovate the curriculum to achieve the learning outcomes. All private higher education institutions offering BSN program needs to have a government permit. So when you offer the BSN program, you need to have the permit and recognition from the government. However, since CPU before was autonomous institution, so we don't need a permit anymore. Autonomous institutions are exempted from a permit, no? From Commission on Higher Education. So shift to an outcomes-based and must secure approval for the shift. Okay, so state universities and colleges are also encouraged to adhere to the provisions of the policies and standards. Okay, we have Article 3 general provisions. So the general provisions of the law says that pursuant to Section 13 of Republic Act 7722, okay, all institutions shall exercise academic freedom. When we talk about academic freedom, you can rearrange, you can add, but you cannot subtract. So in the case of CPU being an autonomous institution, we added certain hours, especially that for Canada and other European countries, because they are looking for additional hours in the related learning experience and the self-directed. So we have more or less increase around 20% for self-directed learning. That's why you have some assignments in a synchronous session, and there is 10% increase in some innovative subjects like our transcultural nursing, as well as the other subjects for research. So we need to comply with the minimum requirements, especially with the two areas of concern, which is the general education and the specific professional courses. So when we talk about the curriculum is primarily composed of the two components. So this includes general education courses. Okay, general education courses. These are your liberal foundation, which is offered, sometimes you call it as your minor subject, but they are not really minor. Then we have your professional nursing courses. So the professional nursing courses are your nursing subject. Okay. So in the interest of academic freedom, we can design the curriculum, but the minimum requirements should be met. Okay, that is spelled out in Article 3. Okay, so we have Section 3. So the articles that follow give minimum standards and other requirements for the implementation of outcomes-based education program. So as defined in Section 3, outcomes-based education is an approach that focuses and organizes the educational system around what is essential for all the learners to know, value, and be able to do to achieve a desired level of competence. Later on, you will know the comparative analysis of the traditional curriculum compared to outcomes-based and the authentic assessment. So the minimum standards are expressed as set of desired program outcomes. So it comes from institutional outcomes, then followed by program educational objectives. Then there is program outcomes, course outcomes, and then we have your learning outcomes. Okay, so this curriculum is shown in Article 5, Section 9. However, we did not really follow the exact arrangement because we need to innovate for our status as accredited and autonomous schools. So there is minimum unit requirement, and there is what we call a curriculum map. So outcomes-based education uses learning-centered or outcomes-based approach. And based on the curriculum, the CHED determined the physical resource requirement for laboratory, and other facilities in the human resource requirements. That's why we have the simulation laboratory. When there is a problem with face-to-face, we have replaced it with our SIM lab, and that is very useful. The Board of Nursing is accepting scrubs already using our high fidelity mods. So we design in such a way that you should have at least a face-to-face and actual scrubs, and you have also scrubs in Lucina or simulation, or also in our operating room skills lab. Okay. So the higher education institutions are allowed to design curriculum suited to their own context and the mission and vision based on their institutional outcomes and professional nursing outcomes, even if it is delivered by a different route. So the outcomes-based education was really designed in such a way that when the pandemic hits, so we did a lot of online teaching, which is also allowed. Okay, provided that the curriculum delivery facilitates the attainment of the program outcomes. So we also have the CHED Implementation Handbook on OBE and the Institutional Sustainability Assessment, or the ISA. So the degree name is Bachelor of Science in Nursing. It's baccalaureate degree. So baccalaureate degree is 3 to 5 years. To ensure quality of nursing graduate, the degree is conferred for after 4 years, either offered by a college, professional institutions, or university, duly recognized by the Commission on Higher Education. In terms of Philippine qualifications framework, and in terms of Asian qualifications framework, nursing program belongs to level 6 because level 1, 2, 3, and 4 belongs to basic education. 5 belongs to what we call high school or secondary and senior high. Level 6 belongs to the baccalaureate degree, professional degrees. And level 7 is master's and doctorate degree. Then we have level 8, that is your postdoctoral fellowship or postgraduate fellowship. So baccalaureate degree is level 6. Nature of the field of study, the BSN is a 4-year program with general education and professional courses. So professional courses are threaded through from 1st year to 4th year with RLA. This is one of the most important component of outcomes-based assessment. You have your related learning experiences, and you have your performance rating scale, which is necessary in order to determine whether the outcomes are really met. The BSN program provides intensive nursing practicum, which you are taking now, that will refine further the nursing competencies to ensure achievement of the BSN program outcomes required of an entry-level nurse. Remember, last semester we discussed about your classification, you are considered to be a first level nurse generalist. You are not a specialist, no? But first level nurse generalist. You can be in any field of nursing, okay? But if after you pass the board exam and you want to specialize by taking master's degree or doctorate degree or even specialty certification courses, then you become a specialist, okay? So first level nurse generalist. The program goals. The BSN program aims to develop professional nurse who is able to apply to assume entry-level positions in health facilities or community setting. When we talk about entry-level position, you are not really required an experience for you to be hired as a nurse because you already have the competence. So hospitals are not allowed to impose a 2-year or a 1-year qualification for those fresh graduates. Okay, they can hire you, then they will train you, and no need for a qualification of experience because you already have the entry competence. Okay, so the professional nurse is capable of providing safe, humane, quality, and holistic care to individuals in varying age, gender, and health illness status, healthy or at-risk family, population groups, and community, singly or in collaboration with other healthcare providers to promote health, prevent illness, restore health, alleviate suffering, and provide end-of-life care. So we discussed in the Republic Act 9173 that the nurse may perform a role of being an independent practitioner. So an independent practitioner, you are practicing singly or alone, or you can be a member of the healthcare team. So we discussed last semester that if you're a member of the healthcare team, you perform all spectrum of healthcare activities, promotive, preventive, curative, rehabilitative. Whereas if you are an independent practitioner, you may only perform promotion of health and prevention of illness. Okay. The specific roles and careers for graduates. So the National Nursing Core Competency, this came out in your exam a while ago. There are 3 major roles of professional nurse. So as generalist, you can assume client care, leadership and management, and research. Beyond the beginning professional roles, the nurse can pursue any of the following career options. The CHED is very emphatic in trying to include advanced practice nursing, but the nursing law is still pending. The amendment to include advanced practice nursing is still pending in Congress. It was not approved. That was already since 2019 when we are pushing for the lobbying of the nursing law. It has not been prioritized whatsoever. So advanced practice nursing has not been legalized in the Philippines, although it is prescribed by the Commission on Higher Education because there are so many oppositions from medical practitioners that nurses should not have prescriptive authority because under the concept of advanced practice nursing, nurses may be given a prescriptive authority. They can prescribe medication. Okay, included in the roles but are limited to ambulatory care, cardiovascular nursing, critical care, diabetes educator, emergency care nursing, enterostomal and wound care, entrepreneurial nursing. So we have done that as your entry competence, gerontology, hospice and palliative, nephrology, neurologic nursing, nursing informatics, oncology, orthopedic, renal nursing, and telehealth nursing. Later on, if you want to specialize, then you will go for some of the specialization courses. Specific to the BSN program, we also have public health and community health nursing, occupational, school nursing, home health, and health and wellness and military nursing. If you want to be in school, then you can be a nurse educator and nurse education specialist. For leadership in governance, nurses can serve as middle nurse manager, or you are a CNO or chief nurse of the organization, or chief nursing officer, or director of nursing service office. The BSN program is allied to the following health-related programs, which means that you can go into the other programs with subjects credited. So this includes dentistry, medical technology, medicine, nutrition and dietetics, occupational therapy, optometry, optometry, pharmacy, physical therapy, public health, in language, or in social science, anthropology, psychology, and sociology. As a member of the healthcare team, it is very important that you connect also with this group of health allied professions. The outcomes-based education starts with institutional outcomes. The institutional outcomes are graduate attributes. For example, CPU, we have the mission and the vision. Then we have the institutional outcomes in your graduate attributes. So you have the graduate attributes of professionalism, technological competence. Some of the core values are integrated in your graduate attributes. So program outcomes are sets of competencies of KSA knowledge, skills, and attitude that all learners are expected to demonstrate upon graduation. So the minimum standards for the BSN program are set in the nursing outcomes. Common to all programs in all types of schools, these are the outcomes. Articulate the latest development in the practice of PQF set 6 indicator for nursing. Effectively communicate orally in writing in English and Filipino, although we phase out Filipino already starting first semester. We don't offer Filipino anymore for the BSN program. During your time, there is still Filipino, but now we phase out because of the Supreme Court ruling that it's not mandated to take Filipino for BSN programs and other four-year programs. Okay, it is discretionary only because there are a lot of Filipino subjects in senior high. Work effectively and independently in multidisciplinary and multicultural teams, act in recognition of professional, social, and ethical responsibility, preserve and promote Filipino historical and cultural heritage. Common to all health professions, demonstrate clinical competence. Clinical competency is very important. Ethical conduct, interprofessional education, communicate effectively and orally and in writing, self-directed lifelong learning. So we have some STL. These are your independent study or self-directed learning. Assumes leadership in management, promotes the use of health systems approach, participate in the conduct of research, and social advocate or mobilizer. Now, specific to the BSN program, you are familiar with the 14 program outcomes. This has to be rich in your outcomes based education for the BSN program. So what are the 14 program outcomes? Apply knowledge of physical, social, natural, and health sciences and humanities and practice of nursing. So you apply the law in physics, sociology, the law of microbiology, anatomy and physiology, and the practice of nursing. Like you use the principle of physics on gravity when you do NGP feeding. When you are moving the patient, lifting the patient, okay, you use the principles of on the force, like friction. So nursing is primarily a borrowed and applied science. It's not really a natural science. So it is just an applied knowledge, applied knowledge or applied science. Okay. So we have provide safe and appropriate and holistic care using nursing process. So nursing process is our base. Apply guidelines and principles of evidence-based practice. Yes. Practice nursing in accordance with laws, legal and ethical principle. Communicate effectively in speaking, writing, and presenting using culturally appropriate language. Documentation and recording, that's very important. Work effectively in collaboration with Entra, and multidisciplinary and multicultural team. Okay. And we have also practice beginning management and leadership skills. So I hope you are doing this now in your intensive nursing practicum. You have a team leader and you have simulated a nurse manager position like being a head nurse. Conduct research with an experienced researcher. Engage in lifelong learning with a passion to keep current national and global developments in general, nursing and health developments in particular. Demonstrate responsible citizenship and a pride of being a Filipino. Apply techno-intelligent care systems and processes in healthcare delivery. Okay. Adopt the nursing core values in the practice of the profession. Apply entrepreneurial skills in the delivery of nursing. Why did we include nursing entrepreneurship in our curriculum, it's because of nursing entrepreneurship. So apply entrepreneurial skills. So common to horizontal typology as defined by CMO number 46 series of 2012. CHED's horizontal typology is based on functional differentiation of higher education institution vis-a-vis their service to the nation. Its type is distinguished on the basis of transparent set of distinguishing feature relevant to national development. HEIs may be differentiated as to qualifications and corresponding competency of their graduates, the nature of the degree program, the qualifications of the faculty, the types of available learning resources, and the nature of linkages and community outreach activities. When we are being evaluated, we are being evaluated on these areas. Okay. So there are three types of institutions that may offer nursing: School of Nursing, or professional institutions. So they contribute to nation building by providing experience to develop technical knowledge and skills like engineering, medicine, law, IT, management, teacher education, and maritime. We don't have so much about professional institutes in nursing. We have more of college-based or university-based nursing education. Colleges contribute to nation building by providing educational experience to develop adults with thinking and problem solving, decision making, communication, technical and social skills to participate in various types of employment, development activities, and public discourses in response to the needs of the community. We belong to universities. We are university based. There are some colleges like Iloilo Doctors College. So we are university-based. So universities contribute to the nation by highly specialized educational experience to train experts in various technical and disciplinary areas, emphasizing the development of new knowledge and skills through research and development. That's why research and technology is emphasized. The focus of developing new knowledge is emphasized from the basic secondary to post-secondary, which is baccalaureate. Academic programs to doctoral programs, research orientation, emphasizing the bachelor, master's, and doctoral degrees. University contribute to nation building by producing experts, knowledge, and technological innovations that can be resources for long-term development processes in a globalized context. Graduates of state colleges and university has additional competence, which is to support national, regional, and development plans. We also have mission-related programs based on our spiritual graduate attributes. So if you try to compare the program outcomes of based on the horizontal typology, when we talk about 1+1, that is only basic competency. But if you have +2, that is advanced competency. So in the different program outcomes that is spelled out in 14 program outcomes, for example, so we have for program outcomes 1, 2, all institutions are only required basic competence for 1, 2. But for number 3, universities are required advanced competence on evidence-based practice, right? Compared to the other professional institutes and colleges. Since we are university-based college of nursing, we need to have advanced competence and evidence-based. The rest are basic competence for outcomes 3, 4, 4, 5, and 6. But for outcomes 7, so all institutions should have advanced competence. Outcomes number 8, advanced competence 2. Except outcomes number 9, conduct research with an experienced researcher. Graduates of university-based college education should have advanced competence. Okay, we already had number 12, applied techno-intelligent care processes in healthcare delivery. We need to have advanced competence also, being a university base. So when it comes to differentiating professional institutes of nursing, colleges of nursing, and university-based colleges of nursing, there are 3 areas that we are higher compared to professional institutes and schools of nursing. So this includes evidence-based research and techno-intelligent care systems. So level outcomes. These are your outcomes that you had demonstrated after you finish your level. So for first year, at the end of the first year, given simulate situations in selected settings, learners demonstrate basic nursing skills and rendering safe and appropriate care utilizing nursing process. Yeah, we do basic nursing skill, nursing procedures through nursing process. For second year, so we have at the end of the second year, given a normal and high-risk mother and newborn, child, family, community, and population groups in any healthcare setting, the learners demonstrate safe, appropriate, and holistic care utilizing nursing process. So in the second year, first semester, you have your normal, maternal and child, but second sem, you have high risk. Okay. Then third year, more of medical, surgical, nursing, so maladaptive patterns behavior. Okay. And fourth year, you have your intensive nursing practicum in nursing process and entry-level position in any field of nursing. So your subjects are arranged in such a way that it meets the level outcome. Okay. So what are the performance indicator? You have to listen intensively to this because you are going to have your personal inventory and assessment as part of your uh, project before the prelim. You need to have your honest personal inventory, whether you have met the standards or not. Okay, so we have first, apply knowledge of physical, social, natural, and health sciences in humanities in the practice of nursing. So in this particular case, you have to assess yourself whether these are all introduced to you or you have demonstrated this or you have practiced and cite some scenario or incident that you have practiced. Okay, so integrate relevant principles of social, physical, natural, and health science. So did you do health assessment of your patient prior to surgery? So you may apply natural and anatomy and physiology, infection prevention. What principles of aseptic technique have you applied? Okay, that's part of natural science, microbiology, chain of infection, right? Why do you wash your hands? Why do you gowning and gloving? This application of principles. Apply appropriate nursing concepts holistically and comprehensively. Okay, sociology, do you interact with the patient and family members? Okay, did you conduct health education? Number two, perform safe, appropriate, and holistic care to individual, family, population groups, and community utilizing nursing process. So these are usually parts of nursing process: assessment, formulation of the care plan, implementation of safe and quality intervention, provide health education, evaluate, institute appropriate corrective action. Okay, you don't really need to enumerate it one by one. The A, B, C, D, E, F, you can just make a narration whether you have practiced it, you have demonstrated it, or it was just introduced to you without being applied or without being practiced in the clinical setting. Okay, so what do you think is lacking in this area? Miss Kumban, do you think there is lacking in this area? In number two, about the steps, the modern steps of nursing process, Miss Kumban.
Yes, Dean.
Yeah, what is lacking in ABCDF? Yeah, there is lacking, right? We jump right away to formulate plan of care. What do you think is lacking as a step in the modern step of nursing process? Because before they have assessment, planning, implementation, evaluation. Ms. Kumban? Yes, Ms. Kumban, what do you think is lacking?
I think it is to formulate the nursing diagnosis
Correct. So
first
diagnosing and
before
analyzing.
creating the plan of
Yeah,
care.
yeah, before plan of care, you need to have identification of nursing problems. So nursing diagnosis, right, is lacking, analyzing and diagnosing. Thank you. Apply guidelines and principles of evidence-based and delivery of care. Provide appropriate evidence using participatory approach, variety of theories and standards related to health and health research, clinical practice, client preferences, client and staff safety, customer care standards. In your quiz this morning, what is the highest form of evidence? So you need to answer systematic reviews, right? That's the highest. Followed by clinical practice. On top actually is clinical practice guidelines, which is derived from systematic reviews. So we also have RISE, no research input from the patient, case studies, and expert opinion. But research is the best source of evidence. Okay. Practice nursing in accordance with existing laws, legal, ethical, and moral principles. Adhere to ethical legal considerations. Apply ethical reasoning. Okay. You can be moral and legal in your practice if you apply reasoning and decision making. Adhere to established norms of conduct based on Philippine nursing law. Protect clients' rights and implement strategies to inform consent. I hope all of you have experienced taking informed consent of the patient, or it was just introduced to you. You never had the chance to educate the patient about informed consent and trying to explain to the patient the principle of BAR, benefits, alternatives, and risk. BAR. You call it BAR. So benefits, alternatives, and risks for your informed consent. Okay. Ms. Asuncion, have you experienced doing informed consent taking?
Yes, sir.
Okay, very good for you. But for some who do not be honest, you can just place there that that concept has been introduced to you only. I hope some of your clinical instructors have trained you or even just introduced to you because you might have lacking competence on how to obtain informed consent. Number 5, of course, you have done this very well. Communicate effectively in speaking, writing, using appropriate culturally appropriate language. Ensure a working relationship with the clients and support system. Appropriate communication, interpersonal strategies. Report or document client care accurately and comprehensively. Okay, you have done recording and reporting. I hope that's a very important consideration when you do recording and reporting. So in leadership in your seminar later, I will be talking about the legal component of recording and reporting. Okay. So you have done a great deal of practice in transcribing doctor's order, recording a nurse's notes, but since most of the hospitals are using FDAR, you do use FDAR also. Mission is narrative still, very traditional. Okay. You have not practiced about SOPIR or SOPIR charting, but in some they have SOPIR charting, no subjective objective assessment plan, intervention, evaluation, and review. Okay, adhere to protocol of confidentiality. Okay. Ms. Capitana, supposing you will be asked, who among the following cannot access the patient's chart? Letter A, the patient himself. Letter B, the FOX of the minor patient. Letter C, the doctor assigned to the patient. Letter D, the lawyer. What's your answer, Ms. Capitana? Ms. Capitanan, are you there? No answer. Okay, Ms. Gascon. Gascon.
May I ask for the choices again, sir?
Yeah, the choices, the patient himself. Letter B, the parents of the minor. Letter C, the doctor and the nurse is taking care of the patient. And letter D, the lawyer. Who cannot access the chart? Mr. Gascon.
Letter C, sir.
Sure. And the nurse taking care of the patient
I mean,
cannot
letter
access
D,
the
sir.
chart. The lawyer of the patient, right? The lawyer of the patient cannot access the chart. Okay. Yeah, it's only the court when the chart is brought to the court, right? The patient can access, right? The parents of the minor, the doctors and the nurses. Collaborate effectively with ENTRA, and multidisciplinary and multicultural teams. Ensure interagency, multidisciplinary sectoral collaboration. We discuss about collaboration and teamwork. Implement strategies and approaches. Capability of the client care provider. Maintain harmonious and collegial relationship, coordinate with the tasks and functions, midwife, BHW, and utility worker. I hope you have done referral to the BHW in the community or even to the orderly and nursing aide. Collaborate with other members of the healthcare team, apply principles of partnership and collaboration, collaborate with government organization, NGO, social civic agency to improve healthcare services, support environment protection policies and strategy, participate as a member of quality team in implementing appropriate quality improvement process on identified improvement opportunity. So maybe the concept of quality is very far and beyond. I'm not sure about with the QA, quality assurance system at Mission Hospital, but some hospitals, they have quality assurance officer, like in Western Visayas or West Visayas State University. And the QA officer is sometimes conducting rounds too for quality processes. Okay, they do PDCA, focus methodology, or anything that we have discussed about quality last semester. Practice beginning management and leadership skills using systems approach. Participate in the development of policies and standards. Manage resources. Apply management and leadership principle. Use appropriate strategy to plan. Supervise the implementation of the nursing component. Ensure that all nursing personnel adhere to the standards and bioethics, evaluate specific components of health programs, maintain positive practice environment, participate in the planning and implementation of staff development, evaluate performance of nursing support staff using standard evaluation tool. You have been a team leader before, Mr. Hichanova. Mr.
Sir, can I
Hichanova,
be
you have
heard?
yeah, you have been a team leader before.
Oh, yes, sir. It was a little bit difficult at first because I have to help manage a couple of my team members, especially in the
So do you
ER.
participate in the evaluation of
Oh, yes,
your
sir.
classmates?
Yes,
Your
sir. They're
clinical
actually doing
instructor,
wonderful, sir.
your classmate, your clinical instructor told you to evaluate your classmate objectively.
Oh, yes, sir. That definitely happened, sir.
Okay, that's good. So it's part of your assessment later that you have evaluated your classmate. Okay. And thank you. Conduct research with experienced researcher. Participate in preparing proposal. Conduct research study. You have done that. Analyze the conceptual framework. You also have to do maybe establish interpretation, analyze the research study, present the research study conducted in partnership with research team. So how far have you gone in your research, Ms. Garbosa? Are you in the final oral defense already?
Hi, sir. We're Sir Alvin is scheduling us for final defense, but currently, some of my classmates are conducting, sir, are in the pilot study of their study, sir.
You are only conducting your study or about to graduate. You should have done with your studies. Okay. You remember you are required a bound report before you graduate. So what's the problem now? Okay. So engage in lifelong learning with passion to keep in current with national and global developments in general, nursing and health developments in particular. Assume responsibility for lifelong learning, demonstrate continued competence, engage in advocacy, model professional behavior, engage in advocacy activities to deal with health-related concerns. That's very important, right? You need to advocate. You speak in behalf of the patient or even a member of your healthcare team. Don't just keep quiet if there are violations of rights or violations of guidelines and protocol. Demonstrate responsible citizenship and pride in being a Filipino, love for the country and service. I hope you are going to serve your country before you go abroad. Customize nursing intervention based on Philippine culture and values. Apply techno-intelligent care systems and processes in healthcare delivery. Use appropriate technology to perform safe and efficient nursing activity. Implement system of informatics to support the delivery of healthcare. So I hope that this is a problem in the Philippines about informatics. I am not sure if other hospitals that you have been exposed to are doing computer charting, or maybe they are using medication administration record using Texas, but there is none. Maybe infusion pumps, you have experienced that as part of techno-intelligent, or you have managed to manipulate ventilators, or maybe in dialysis machines, etc. So who among you had the experience of putting up an infusion pump? Can you raise your hand? No one? Not only in the sim lab, but also actual patients using infusion pumps? No one in your ABCD? Okay, Barrios, yes. Who else? Okay, so I hope if there is a chance, then you have to ask your clinical instructor for you to have experience how to manipulate that. Uphold the nursing core values in the practice of the profession. Demonstrate caring. It's the core of nursing. Love of God, love of country, and love of people. These are the three core values of nursing profession. Manifest professionalism, integrity, and excellence. Project positive image of a nurse in terms of your language, behavior, how you behave in social media. Apply entrepreneurial skills in the delivery of nursing care. So you have nursing entrepreneurship. I hope you get a good time and a good learning experience on how to put up a business related to healthy nursing. Identify opportunities for entrepreneurial, apply strategic interventions to address health-related concerns, population groups in any healthcare setting. So based on the standards of the PQF, graduates of the BSN have level 6. I told you about that. So knowledge and skills and values are broad and coherent on basic clinical nursing practice and research for professional creative work and lifelong learning. Application, you should have professional creative work in a specialized area of clinical nursing, research, and further study. Degree of independence, independent of the teams in the field with a very minimal supervision. So please take note, when you practice later, you are not a student anymore. So you have to behave independently, but you have to ask your head nurse if you have any question. Other hospitals, they have the so-called mentor-mentee relationship. In the US, you cannot be alone unless your mentor and your preceptor would evaluate that you can be independent. So that is what is lacking in the Philippines. We lack staffing, but in the US, they are really required to have preceptor-preceptee relationship or mentor-mentee. Some hospitals, they require you 3 to 6 months of preceptor, and you should not be on your own until you can be independent and expert in the provision of the nursing care. So to provide progressive advancement to program outcomes, the nursing curriculum is distinguished from curricula for postgrad, baccalaureate, as well as the doctoral and postdoctoral degrees based on the guidelines of Philippine Qualifications Framework. Doctoral master's program is level 7. Postdoctoral and postgraduate fellowship is level 8. So nursing as baccalaureate or bachelor's degree is level 6 for the entry system. Okay? So we will have a short break, 15 minutes. So we have to be back by 9:25. We are going to discuss the 2 other material. Okay? See you at 9:25.